Hi everybody, I am Dr. Manabhanjan Jena, Senior Consultant Interventional Cardiologist, currently working in Utkal Hospital, Bhubaneswar, Odisha. Today I am going to discuss about the important topic, ambulatory blood pressure monitoring and its importance. Ambulatory blood pressure monitoring it provides a 24 hours accounts of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. BP level measurement using home or ambulatory blood pressure monitoring is recommended in patients with office blood pressure classified as high normal blood pressure or grade 1 hypertension, where systolic blood pressure is 130 to 159 millimeter mercury and or diastolic blood pressure is 85 to 99 millimeter of mercury. Ambulatory blood pressure monitoring provides the average of blood pressure recording over a defined period, usually 24 hours. The device is typically programmed to record blood pressure at 15 to 30 minutes intervals, and an average BP values are usually provided for the daytime, nighttime, and 24 hours. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable BP recordings are required for a valid ABPM measurement session. Ambulatory blood pressure monitoring values are on average lower than the office blood pressure values, and the diagnostic threshold for the hypertension is more than equal to 130 over 80 millimeter mercury over 24 hours, more than equal to 135 to 85 millimeter mercury for the daytime average, and more than equal to 120 to 70 millimeter mercury for the nighttime average, all equivalent to office blood pressure more than equal to 140 over 90 millimeter mercury. Let's discuss about the advantage of ambulatory blood pressure monitoring. It's a better predictor of hypertension-mediated organ damage than office blood pressure. It's a 24 hours ambulatory BP mean has been consistently shown to have a closer relationship with morbid or fatal events. It's more sensitive risk predictor than the office blood pressure of cardiovascular outcome, such as coronary morbid or fatal events and stroke. More sensitive, it can identify white coat and masked hypertension. It's a stronger prognostic evidence. It has nighttime recording. Its measurement in real life settings, and it has additional prognostic blood pressure phenotypes. It has abundant information from a single measurement session, including short-term blood pressure variability. Let's discuss about the disadvantage. No doubt it's expensive and sometimes it has limited availability. It can be sometimes uncomfortable. So, ambulatory blood pressure monitoring has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from European Society of Cardiology recommend that diagnosis of hypertension should be based on repeated office blood pressure measurements or ambulatory blood pressure measurement if economically feasible. Analysis of various indices on the ambulatory blood pressure monitoring graphs such as hyperbaric index, diurnal index, dipping, and other indices can provide useful information about the prognosis of the diseases such as hypertension, diabetes mellitus, chronic kidney disease, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ambulatory blood pressure monitoring is the single most effective tool to diagnose white coat hypertension, masked hypertension, and nocturnal hypertension, and it can help direct the such patients when required. Overall, ambulatory blood pressure recording can guide towards the prognosis of underlying organ damage and can be useful predictor of cardiovascular risk. Thank you.